Uttar Pradesh is the largest emitter of PM 2.5, the class of particulate matter considered most harmful to health, according to an analysis by Council on Energy, Environment and Water. What is particulate matter 2.5? PM 2.5. The term fine particles or particulate matter 2.5 or PM 2.5 refers to tiny particles or droplets in the air that are 2 and 1/2 microns or less in width. Outdoor air levels of fine particles increase during the period of stagnant air, that is, very little wind and air mixing. When the particles are not carried away by wind, or when winds bring the polluted air into the state from sources outside the state. In general, as the levels of PM 2.5 in the outdoor air increases, the air appears hazy and visibility is reduced. Where does PM 2.5 come from? There are outdoor and indoor sources of fine particles. Let's discuss about the fine particles from the outside. Outside fine particles primarily come from car, truck, bus and off-road vehicles. Example, construction equipment, snowmobile locomotives, exhausts and other operations that involve burning of fuels such as wood, heating coal or coal, and natural resources such as forest or grass fires. Fine particles also form from the reaction of gases or droplets in the atmosphere from the sources such as power plants. As the fine particles can be carried long distances from their source, events such as wildfires or volcanic eruptions can raise fine particle concentrations hundreds of miles from the event. Some indoor sources of fine particles are tobacco smoke, cooking, example, frying, sorting and broiling, burning candles, or oil camps, and operating fireplaces and fuel burning space heaters, example, kerosene heaters. How can PM 2.5 affect our health? Particles in PM 2.5 size range are able to travel deeply into our respiratory tract and reaching the lungs. Exposure to fine particles can cause short-term health effects such as eye, nose, throat and lung irritations, and it can lead to coughing, sneezing and having a runny nose and shortness of breath. Studies also suggest that long-term exposure to fine particulate, especially for the people who are living in the Uttar Pradesh (UP), may be associated with increased rates of chronic bronchitis, asthma, reduced lung function, and increased mortality from the lung cancer and heart disease. People with breathing and heart problems, children and elderly, may be particularly sensitive to PM 2.5. Chronic exposure to high pollution is associated with increased risk of miscarriage and early labor in the pregnant women and low birth. Thank you very much for watching, and if you like more interesting news, please subscribe to our channel. Thank you.